Once it has to do with the practice of medicine, I give off my all. At the same time, I also have family. I have my wife. With time, there will be massive adoption of AI and also technology to add
the skills they should acquire or adapt to, so that with this advancement, they may not lose their job in the way or
a functional ICU. Unfortunately, we have very few in this country.
How do you balance this life, like your social life and your family's and friends' life, and maybe time for games and all those things? How do you balance them as a neurosurgeon?
So for me, I believe that in as much as it is very important to have excellent behavior, excellent attitude towards neurosurgery, I also don't joke with other aspects of life, because a doctor or a neurosurgeon who knows only neurosurgery doesn't actually know neurosurgery, because there are so many other determinants of health and determinants of neurosurgical conditions that are not only in the hospital. And so I try to balance my life in a couple of ways. So I have my working life or my life as a doctor. I don't joke with my life as a doctor. I try to give off 100% or 200% in everything I do as a medical doctor. Once it has to do with the practice of medicine, I give off my all without fear or favor or without any discrimination. I give off my all. At the same time, I also have family. I have my wife. She is Charlotte Dery. She is currently a midwife at the antenatal clinic of the Tamale Teaching Hospital. She has been very, very supportive in this journey from the period even as a medical student.
Hold up. Wait a minute.
And now that I'm doing residency in neurosurgery, she understands that this field of neurosurgery is not an easy one. It requires a lot of support. It requires a lot of care. It requires a lot of dedication. And so my wife has been very supportive of this journey so far. There are even instances where she actually accompanies me, gives me support to come and see patients late into the night, especially when the kids have just arrived as an emergency and I just get home to try to freshen up, and there's a need to come back. There are several days that she has accompanied me to this hospital at 12 a.m., 1 a.m., 2 a.m. to see patients. There are sometimes that she comes around just to check up on how my day is going. So I'm lucky to have a wife who is understanding and understands exactly what I do and the fact that I need a lot of support. She's been so supportive. I have so many family members and friends who are so supportive. My colleagues, my friends, constantly on a daily basis, people are checking up for me, supporting in one way or the other. I'm lucky to also be associated with UDS medical students. They give me a lot of support. I get a lot of support from medical students, from especially the UDS medical school and other schools. They give me a lot of support. It's always a joy being with my friends in the medical school, and I get a lot of support from them as well. I get so much support from my senior colleagues. My consultant, Dr. Abbas Adam, who is a fellow of the World Federation of Neurological Surgeons and also who is my training head in the Tamale Teaching Hospital. He supports me so much. He supported me from the beginning, guiding me in everything that I need to know about neurosurgery. And actually, he has just held my hand and has supported me so far in this journey and keeps supporting on a daily basis. I have Dr. Dixon Bando, who is one of our neurosurgeons. He's been so supportive in the period when I was a medical student, as a house officer, as a medical officer, always checking up, ensuring that I get to learn the right things and practice in the right way. Then I also have Dr. Abdulaziz Mahama, one of our neurosurgeons in TTH. He's been so supportive, guiding, mentoring us as well. And so I have so much support. Aside my immediate trainers in Tamale, I also have support from all the faculty members of the Ghana College of Physicians and Surgeons who are with the neurosurgery faculty, and also those not with the faculty but with the Ghana Academy of Neurological Surgeons, the GANS. It's a community of neurosurgeons, and they are so supportive in this journey. They are putting in all the support they can to ensure that we have a very good training. And my colleague residents who are doing neurosurgery, we keep supporting each other. So they've been so supportive. Those here in Tamale Teaching Hospital, those in elsewhere in the country. And I want to specifically mention Dr. Jennifer Yenuman Berrick. She is a colleague doing neurosurgery residency currently in the Greater Accra Regional Hospital. She's also been so supportive as well. And of course, there are people who are in my church, who are in other social groups that I belong to, who support on a daily basis. Some of the support in cash, in kind, prayers, and goodwill. These are all supports that I don't take for granted. And of course, the number one support is coming from God. It is God who has brought me this far, and I believe that whatever that I'm yet to achieve, it is God who is going to take me there. So as for support, I'm so lucky, I'm so fortunate to have support from so many people. My parents, my siblings, my in-laws, everybody supports me. Everybody supports me in this journey. I'm so grateful, and God bless them all.
Oh, wow. An understanding and a supportive wife. Hello, Madam Charlotte. We thank you and continue supporting our noble and humble man for us. And in your point of view, what do you think is the most challenging aspects in neurosurgery?
So in Ghana, neurosurgery is not easy to practice. Neurosurgery should be, we have to lay this premises that the cost of neurosurgical care, it is expensive everywhere globally. And the reason why it's expensive is because the equipment that are used are expensive. And these are equipment that there's no other option than to use those equipments and consumables and implants. And so the practice of neurosurgery comes with a lot of financial constraints. And so for neurosurgery practice to be at the top or at the peak, you require a lot of governmental support. In Ghana, in neurosurgery, I know there have been some support from government. However, the support is woefully inadequate. There are so many challenges that has to do with neurosurgical care. In fact, most neurosurgical conditions are not covered by the National Health Insurance. And so it becomes difficult, it becomes challenging for patients to be able to raise funds to take care of their neurosurgical conditions. And so one of the main things we are lacking is inadequate support from the government and from other institutions that could be of help. And another thing has to do with the fact that aside the support, there's also still some myths and misconceptions about neurosurgery. And so that also doesn't help with the work as we do as neurosurgeons. Then we also have challenges with the numbers. We don't have a lot of neurosurgeons in Ghana. In fact, it is in recent times that by the hard work of the Ghana Academy of Neurological Surgeons, in collaboration with the Ghana College of Physicians and Surgeons, they'll be able to start this trade program for neurosurgery so that we can raise the number of neurosurgeons in Ghana, because currently there are very few neurosurgeons serving a huge population of the country, and so it becomes difficult for them to be able to take care of all these people, and so numbers is also an issue. So these are some of the challenges we are having as an issue. And again, the healthcare structure in the country also, as it stands now, doesn't support the practice of neurosurgery or neurosurgical conditions in the whole part of the country, because for you to practice neurosurgery, you need some specialized equipment. You need to have a functional ICU. You need to have very sophisticated devices, imaging modalities. Unfortunately, we have very few in this country. And even with the few, most of them are concentrated at usually in the bigger facilities, the teaching hospitals and the bigger regional hospitals. And so that makes because of the inequity in the distribution of, first of all, the surgeons and then the equipment and the general healthcare structure, it makes practice of neurosurgery quite challenging in Ghana. However, we've not lost hope. You know, when you are in a particular field, you have to contribute your quota toward the development and sustainability of that field. And so our senior colleagues are doing very well in trying to ensure that these challenges are surmounted. Hopefully in future, when we also become neurosurgeons, we are going to continue and support our senior colleagues and continue the good work they've done so that we can have adequate infrastructure, adequate number of neurosurgeons, and also a better healthcare structure that will ensure that neurosurgery practice is made widely available and acceptable and throughout the country, and also to try to demystify some of the myths, mysteries that are surrounding the practice of neurosurgery in Ghana and in Africa, and by extension in the world.
Yes, we've not lost hope on you. Yes, you. Please, we need you to come and do neurosurgery. We are few. And look at the population in Ghana. We are over, I think, 8 million. Well, I don't know. But look at the number of neurosurgeons. So we need you. In your opinion, what do you think the role of technology and AI in neurosurgery? Is it helping or it's not helping?
So neurosurgery will depend a lot on technology. If you go back into the history of neurosurgery, you realize that in the early times of neurosurgery, during the evolution of this whole concept of neurosurgery, they tried to do things mainly without a lot of technology. And so, with the advancement of technology, especially with imaging, that has really advanced the practice of neurosurgery, because previously it was just X-rays, and then by the work of Hansfield and Co, we were able to get CT scans and then MRIs. Now we have availability of PET scans, we have availability of functional MRIs, we have availability of other sophisticated scans, SPECT scan. We have all these neuro navigation devices, ultrasound, sophisticated ones that help to diagnose and then actually are used to treat neurosurgical conditions. And so, for neurosurgery and technology, it is like they are brother and sister. You cannot practice neurosurgery without proper technology. Even if you look at microsurgery, you require endoscopes, you require microscopes to be able to see these minute structures. Remember at the beginning, I mentioned that it is small fibers and nerves that have come together to form the brain and the spinal cord. And so you need to have devices that can go deep into tissues to pick up these fine structures. And so neurosurgery and technology run side by side. And with the advancement of AI, it is another area that is going to benefit neurosurgery, because with AI, it will help with improving diagnosis, it will help with improving pre-planning for surgery, and also with surgical interventions. AI technology is one that is really going to revolutionize the practice of neurosurgery. And then it is one area that, in terms of exposure, the exposure has not been so massive for neurosurgical residents and even some neurosurgeons, but I'm sure it is still evolving. With time, there will be massive adoption of AI and also technology to advance the care of neurosurgery.
Oh, okay, that's nice. So with this advancement in technology and AI, so the AI is really getting scary because the kind of videos this AI are making currently. So what do you think the future neurosurgeon, the skills they should acquire or adapt to, so that with this advancement, they may not lose their job in the way, or they may not be jobless because of maybe the skills they lack in the near future.
Yes.
But
So technology is very good for neurosurgery, as I mentioned, and I don't believe technology AI is coming to knock out neurosurgeons. With the advance of AI, is going to support the work that we do as neurosurgeons. You cannot rule out the fact that people are scared that AI may take over the practice of neurosurgery or the practice of medicine. However, I believe that whatever be the case, you always require the physical presence of the neurosurgeon or the doctor, because eventually it is what we are going to feed into the AI that the AI is going to use to work. And so you always have the knowledge base from the human aspect to be able to feed that into the AI for it to be able to support in the work that neurosurgeons do. And so what we have to do is also to continue advancing our skills, especially with microsurgery, minimally invasive surgery. With those ones who have few side effects and better outcomes with minimally invasive surgeries. And of course, the AI is just coming to support. I don't think AI will take over the work of neurosurgery or neurosurgeons. We have to place ourselves to see ourselves as collaborators in ensuring that there's better outcome for neurosurgical conditions.
okay, so a little bit of personal question. Will you encourage your child to take a neurosurgery career?
So for my child, I believe that the child should have the option to decide which area of the society he wants to belong to. And so if any of my children decides that he wants to be a doctor, of course, I'll expose him to neurosurgery, I'll expose him to every other aspect of medicine, and then I'll guide him to make an informed decision. Of course, the fact that I'm a doctor doesn't mean necessarily my child or my children should become doctors. They may have other skills, other knowledge that they will become better off in another aspect of society. But if for some reason they choose to follow my pathway and also become a doctor, why not? Neurosurgery is always one that I will try to talk to them to consider it, but it will have to be a decision that will be not only my decision, the decision of the child, the decision with my wife, and then together we see the child's strength. If the strength is in medicine and it's in neurosurgery, why not he or she will get all the support he needs to become like me or better than me.
Okay, so any final words for the viewers out there who is pursuing medicine or neurosurgery?
So to my friends, to my colleagues who are out there who are in medical school, who are doing housemanship, who are medical officers who want to do neurosurgery, I urge you to put in a lot of effort, be dedicated, try to acquire a lot of knowledge, try to remain committed, try to remain focused, don't get distracted by other things in the society, try to remain focused, and then just take every day at a time. One day, once you finish medical training, you finish housemanship, you start neurosurgery. One day will be colleagues in the field of neurosurgery. So I urge you all to remain steadfast, remain faithful in what you are doing, learn hard, try to balance your life as much as possible, your social life, your religious life, your academic life, and every other factors that make life enjoyable. Try to enjoy every day, enjoy every moment, have a balanced life, and then stay on course. And one day, you also become a neurosurgeon.
So it's Christmas. Are there some special people, just a few, one or two, three people that you like to wish?
So it's Christmas. It's been a very long year for us as a country. We've gone through rigorous elections. By the grace of God, this country is still very peaceful. We thank God for that, and we thank God for Christmas. Christmas is here upon us again. So I want to take this opportunity to wish everybody who is viewing this video a Merry Christmas and a prosperous New Year. May the incoming year be one that will be filled with God's blessings and favor, and may everybody's dreams and aspirations come to pass. I specifically want to wish my wife, Charlotte, Dery, a Merry Christmas and a prosperous New Year. I wish my family, my parents, my in-laws, my brothers and sisters a Merry Christmas. I wish all UDS medical students a Merry Christmas. My colleagues, my supervisors, my teachers, my bosses, everyone, I wish you all a Merry Christmas and a Happy New Year.
And you also watching, Merry Christmas and Happy New Year.
Merry Christmas.
Bye-bye. Thank you for joining us today.
Thank you.
Have a nice day.
Thank you.
Bye-bye.
Bye.
Mm-hmm.